In a patient that presents with hypertension and with diabetes or maybe obesity as well, metabolic syndrome, how can Hijama help these patients as a form of adjunctive therapy?
Hijama is something very superficial procedure. It's natural way to treat yourself. So it's a suction of stagnant and thick blood under your skin and the muscle, which we remove out through the incisions over the skin. Removes all of your toxins, impurities, dead cells, bad proteins, whatever toxins collected under your skin and muscle. So body pushes it towards the skin and we remove it through the suction and through the scratches. So many theories have proven that if you do hijama in hypertensive cases, it decreases your blood pressure for 4 weeks. Do you believe?
Of course, and I think, like you've mentioned, you're targeting stress as well. That's sometimes the underlying problem of everything.
It's not just the stress. There is a full channel for the stress. We are stimulating all the channels so that the head to toe your body should be relaxed. You don't take much stress. You are not negative.
Stress is there every day. All of us are going to experience some form of stress, but the difference is how you handle stress. How do you deal with stress? So if something is there as a form of alternative therapy that can help you manage your daily stresses a bit better, why not? Hello and welcome to Orthosports podcast. My name is Dr. Rochael Debideen, and today we're going to be discussing a really interesting topic with you. And that is no other than hijama therapy. So, in studio with us today, we have our expert, Dr. Hina Ansari, who's a specialist hijama therapist at Orthosports. And she's going to be providing us with all the insights about hijama therapy, the advantages, and we're also going to tackle some myths today regarding this topic. Dr. Hina, welcome.
Thank you so much, Dr. Rochelle. Thank you for the introduction.
It's a pleasure to have you. So, Dr. Hina, to be quite honest, before moving to the UAE, hijama therapy was not something that I was familiar with. It wasn't something that was widely practiced in South Africa. And there's a lot of Western countries whereby maybe it's not as common as an alternative form of medicine.
Okay.
So, for people that are at home who have no idea what hijama therapy is or who are unsure about this form of alternative therapy, can you please tell us what is hijama?
Yeah, sure. So hijama is an Arabic word. In English, we call it as a wet cupping. People do familiar with the word wet cupping. So it's a section of stagnant and thick blood under your skin and the muscle, which we remove out through the incisions over the skin. So actually, it's the suction of your toxins and impure blood through the skin through the cuts. So this is a superficial procedure which we do through the incisions on the skin. And yes, it removes all of your toxins, impurities, dead cells, bad proteins, and whatever toxins collected under your skin and muscle. So body pushes it towards the skin and we remove it through the suction and through the scratches.
So, what you're saying is that it's the dry cupping, but this time we're using small incisions to extract blood.
Yes, there is a difference between dry cupping and the wet cupping. Dry cupping, we just put the cups with the negative suction over the skin and we'll keep the cup as it is. We don't take any incision, we don't take any cuts, and we don't remove the blood. But when we talk about hijama, yes, it's a wet cupping. We do take incisions on the skin and we remove out some amount of blood. So it's a different, there is a difference between wet cupping and the dry cupping.
Okay, that's actually so interesting. If we have to look at hijama therapy then in Eastern countries, it's a very common practice. It's a very common form of alternative therapy. And I would love to know the history behind it. Like, how did it become so common? Where did it originate?
So mostly people, they don't know this is the origin from the Arabs. It's an Arabic procedure, and it is also called as a Islamic procedure also, as our beloved Prophet also does it. So in Arab countries and in Western world, they know it as a Sunnah, as a part of their religion. But yes, there are some scientific benefits, some healing benefits, and there are some cure also. So people, they do that. Now the awareness is too much, so each and everyone, they are encouraging other people to make hijama for certain ailments or any pain or any kind of diseases.
So then is hijama therapy something cultural or religious, or can anybody do it?
Yes, so there are two kinds of hijama. One is religious hijama and the other is therapeutic hijama. When we call it religious, it's about the prophet. There are some prophetic cups, some prophetic sites which we cover through the cups and through the suction of the blood. And there are some therapeutic cups. Therapeutic, when we say, it means we are treating the problems. We are treating certain diseases, any kind of muscular, nervine pain, any kind of a metabolic disorder, we'll say, yeah, cholesterol, diabetes, blood pressure, any indigestion, constipation, even hormonal disorder also we can treat with hijama, which most of the people they don't know.
Yes.
They means it's just this is a myth what we were talking about, that it's just a religious procedure just for sunnah, but most of the people they don't know that it's a curative, it's a treatment also. If you are suffering from certain diseases disorder, you can treat yourself with the hijama.
Wow. And so, if one has to have hijama therapy, so in the event that I'm not of the same faith as you are, I can now do therapeutic hijama
Correct, yeah.
to treat a medical condition.
Yes.
Okay. So, with hijama therapy, then, you've mentioned the history behind it, but can you tell us a little bit of physiology behind it? How
Yeah.
does it actually have these benefits?
Yes, definitely. So we are targeting certain site through the cups. We create a negative suction. Suppose if you have shoulder pain or a back pain, we apply the cup on the regarding area with the suction. Well, so when we put the pressure, so with the negative pressure over the area, there is more circulation increases. You can see when we remove the cup, the certain area because becomes hyperemic. It
Mhm.
becomes sometime reddish, sometime you can see the blackish discoloration over the skin. Okay, so whenever we create a negative pressure on the body, it initiate the blood circulation over there, and this blood is more in nutrients, vitamins, and more oxygenated blood. That's why we take the cuts over the skin and we help the circulation to get improved, so that once we remove the thick and toxic blood, which is barrier between the circulation, so the body sends new blood over that area. So the new blood circulates all around your body. You feel refreshed, you feel energetic, and when we remove the stagnant and collected blood on the regarding area, the muscle tension it goes, and yeah, the overburden on the nerve it goes. So your 50% pain disappear that time only.
Yeah.
So yes, it improves the blood circulation, which is more in nutrients and vitamins, and definitely the body food is of fresh blood. Whatever organ, muscle, or joint will receive a new blood, the oxygenated blood. Definitely, it will work more, and the physiology will improve, and definitely the pain will go.
I can honestly relate to pain relief. So, if you remember, I saw you a few weeks back and
Yes.
I had a horrible migraine whilst at work. And I was really interested about hijama therapy. It wasn't something I ever tried before. And I wanted to see if it made a difference to me because I had a severe headache that wasn't being relieved with normal painkillers. And I needed that instant pain relief. And that's when I came to see you.
Yes.
Was I a little bit scared? Of course. Okay. It was something new to me, but you made me feel so comfortable during the procedure. The way in which you explained what was going to happen, you calmed me, you relaxed me. And I thought maybe it would be a little bit painful, but it honestly wasn't. In fact, it was a bit ticklish, if I have to be
Yes. Yes.
completely
Yes.
honest. So I felt really comfortable. And what surprised me the most is the pain relief that I got. When you put those suctions on my head and my temples, it created such a different feeling. When I left that room, not only did I have pain relief, but I felt calm, almost like my mental focus and clarity was better. I was energized the entire day, which is not common, right? For someone having a migraine, you normally have a lot of downtime. You want to be in a closed, dark room, no sound, and you just want to be left alone. But I felt better. I felt more energized. And I was surprised because I had the best sleep ever that night. So I was quite pleasantly surprised about how hijama had basically impacted on my life for that session that I had received in a time where I needed pain relief. And to be quite honest, from the time I had hijama therapy done, I found a decrease in my frequency as well as the intensity of my migraines. So that's why we are here today. It's to let people know that this amazing form of alternative therapy exists and you can incorporate it into your lifestyle should you have chronic ailments. So I'd like for you to tell us about hijama therapy and pain relief.
Yes, you're right that there is a myth that is very, very painful procedure.
Yeah.
And when you go through YouTube videos and Google things, so yes, definitely you see some kind of videos and photos which scares you.
Yes.
But definitely it's very invasive. It's a very superficial procedure, and 99% of my patients they get ticklish. So it's true that it's
Yes.
ticklish, and it's just human psychology when you hear about cuts and blood.
Yes.
So it's a psychological pain.
I think also when you're looking at the pictures
Correct.
of the cups with the blood, it automatically creates a sense of, oh my gosh, I'm a bit
Yes.
scared or hesitant. But it's not actually that. When you're actually going through the procedure, it's such a comfortable procedure. You don't even feel the cuts and they're so superficial.
Yes, so that's why we are applying the cups and we are waiting for a minute or two to get the area numb 50% so that you cannot feel even the cut. Some patients of mine, they are saying somebody is writing on my back, and some patient they say it's just like a mosquito bite. Even we do have kids, do you believe?
Really?
Yeah, we do have kids who now, as I said, there is too much of awareness about hijama, so people are
Yes.
encouraging their kids also to make it just for their health, for muscle growth, bone growth, and for their mental health. So for that also we are some kids also for hijama.
So what age then would children be allowed to do hijama?
See, there is no any age restriction. Like I said, it's a kind of treatment, so any age can do hijama. There is no any age restriction. I highly recommend kids also should start. Definitely with the kids, our way of working is different from the
Of
adults.
course,
They
yes.
they may scare, and they may get worried about the cuts and
course.
scratches. But we have different kinds of cups. We are very, very gentle with the kids so that it can make them happy, more energetic, and we also want to encourage them to continue with the hijama therapy. So definitely we are very, very gentle with them.
So you mentioned cups. How would you know how many cups to use? Because I see often there's advertisements for unlimited cups or 5 cups or 10 cups. What does that mean?
See, there is not any unlimited cup. There should not be any unlimited cup because it's your body.
Yes.
It's your body. It's about blood, and it's not just one time suction of all the blood. Your body should accept this procedure, and we had to go slowly.
Yeah.
So person to person, the problems are different. So definitely their session will be one person's session will be different from the other. Your problem is something else, so definitely you need another kind of treatment, and another person have some other issues, so definitely they need another number of cups. So we cannot fix for a number of cups for this therapy. Person to person it changes.
So I think the take home message is that it's not to say that if you have unlimited cups, then you're going to feel the therapeutic benefit.
Correct.
It's patient orientated.
It's patient oriented.
It depends on your problem. If you have a certain problem in a certain area, the doctor assesses you and sees where the problem area is and what would suit your body and your needs.
Correct.
Right?
Correct.
So you may have 1 cup or 2 cups. And you may, in example, someone with maybe localized muscular problems, and you may still have the same therapeutic benefit as
Correct.
opposed to someone with more cups.
Yes. Like if you have some metabolic disorder, suppose it's a hypertensive patient, they need more cups. Like we have to cover all the detoxification, then kidney,
Yes.
then hormones, and because it's a lifestyle disorder, so we have to cover immunity as well.
Yes.
So definitely one person is very different from other, and some kind of metabolic disorder, they need multiple cups. It doesn't mean that everybody has to make 2 to 7 cups or 10 cups. It's really not like that.
Of course. I think you've mentioned lifestyle diseases, and as a doctor, I know we've been seeing such an
Correct.
increase in lifestyle diseases, and there's multiple factors, inactive, sedentary lifestyles, not eating the correct foods, amounts of stress that people are going
Yes.
through in their daily lives. And in a patient that presents with hypertension and with diabetes, or maybe obesity as well, metabolic syndrome, how can hijama help these patients as a form of adjunctive therapy?
Yes, definitely. I'll speak on that. So, like I said, hijama is something very superficial procedure. It's natural way to treat yourself. So, first, like we take cholesterol. What is the cholesterol? It's the thick blood. Okay. So, for the thick blood, we need to remove your toxic blood so that the new blood can form, and then the new oxygenated blood can circulate all around your body. So, we have number of cases from hijama. We have treated for cholesterol. Okay, so definitely sessions of hijama makes your blood pure, oxygenated, and the thick blood goes out. The fat lobules it goes out. With that we cover the fatty liver also, because what is the cholesterol? Because of the fats around the liver, which cannot digest. We cannot metabolize through the liver. So we target your hepatobiliary system. We target your circulatory and detoxification system, and with few sessions of hijama the cholesterol get recovered, and we have the proven cases also. So many theories have proven that if you do hijama in hypertensive cases, so it decreases your blood pressure for 4 weeks. Do you believe? So yes,
Wow.
definitely we encourage all the people to means before starting with the medication, first try some natural ways to recover themselves, and just make a lifestyle changes. And definitely we all need that. Like there is a stressful life, we are not focused on one thing, bad sleep pattern, then we have fast food, and we are very stressed. So also we offer hijama for stress relieving therapy also. Like you can release your tension, worries, stress through this session. How it helps? So it promotes the hormone serotonin, which is the hormone of
Yes.
happiness.
Yes.
So definitely when your serotonin is enough in your blood, you are not going to take so much of thing on your head. You will be calmed down. You have a nice peaceful sleep, and definitely it will release some tension and stress from your body.
Oh, that's really, really interesting. Thank you for that. And I think that, from my side, I mean, 70% of the patients that I see have high cholesterol,
Yes.
okay? And maybe about 40% of them have fatty liver. And one of the most common questions that I get, the first question the patients ask me is, Doctor, what are some of the natural ways that I can bring my cholesterol down without having to be put on medication?
Yes.
So I love the fact that, you can use this form of alternative therapy in conjunction with either medication or lifestyle
Yes, correct.
changes. So with cholesterol, you've mentioned, you see fat lobules. So can you expand a little bit about that?
Some people I saw that they don't get the symptoms that they have cholesterol, means suddenly when we ask the patient that do you have any medical history, they say no. And then
Yes.
we start hijama, we get the fat lobules, means it's not directly fat lobules, we get a
Mm.
serum or a liquid like yellowish or whitish on the top of the dark color blood. So we understand, okay, this patient may have the cholesterol or may have the fatty liver, some degree of fatty liver. And when we check with the blood test, so it's more than 300 or 400, yeah. So
Wow.
I understood that if it is a borderline, we cannot make it out through the quantity and collection of the blood. But yes, if it is more than 300, so we can see in the blood that the blood changes also signifies something, that patient may have high bilirubin, patient may have cholesterol. And the force, the how the blood collects in the cup, the force, the pressure of the blood also suggests that maybe the patient is having hypertension or low blood pressure. So yes,
Yeah,
with the experience and with the time, we understand that each patient is different from others,
of
like I said.
course.
And the quantity, the color, and the flow of the blood also suggests there is something different from with the patient.
That is amazing because, Western medicine always looks at evidence based medicine,
Uh-huh.
right? And
Yeah,
we
yeah.
want to see science behind it. So
Correct.
the fact that you're doing a treatment and you're physically seeing an improvement, whether you're seeing a reduction of blood pressure or you're seeing a patient from just hijama alone and you're seeing fat lobules coming out in those cups, that's actually great evidence.
No, now we are working for the fat loss also. We are for fat loss, for weight loss also. We are working, and there are 2, 3 patients who lost also within 6 months. They lost 16 kgs
Wow.
with hijama, and yes, definitely we have to make them we have to put them on some diet control also. So yes,
Yes.
it's a balance. It's a balance between
Course.
the lifestyle changes and through the hijama we are working on that for fat loss, and through the sessions they are losing some kgs. So this is also a wonderful thing we come to know from the patient only.
Of course. And I think, like you've mentioned, you're targeting stress as well. So
Yes.
that's sometimes the underlying problem of everything.
It's not just the stress, there is a full channel for the stress. We are stimulating all the channels so that the head to toe your body should be relaxed.
Of course.
Whatever comes, you should not take all the things on your head.
Yes.
Oh, sorry, you cannot fix everything.
Yes.
Yeah, so yes, so it makes your body calm down. Okay, you don't take much stress. You are not negative. This is the one thing we see in the patient, that the temperament goes down. Okay, you are not negative for everything. You take your time to think over. Okay, you calm down yourself, even though you are having good sound sleep. When we say sound sleep, it means without any break. It's a continuous sleep.
But then that manifests into your daily routine. If you're having a good circadian rhythm and you're getting your enough sufficient deep sleep,
Correct.
you are going to automatically wake up feeling refreshed. And if you have reduction of anxiety and stress is there every
Every
day,
day, yeah.
all of us are going to experience
Correct.
some form of stress. But the difference is how you handle stress. How do you deal with stress? So if something is there as a form of alternative therapy that can help you manage your daily stresses a bit better, why not?
Yes, correct.
So, with respect to some of the medical conditions that hijama can actually be beneficial for, you've mentioned chronic illnesses like lifestyle diseases. We've mentioned hormonal problems, okay, as well as musculoskeletal problems. Some of the other problems would be stress, anxiety, insomnia. What other conditions have we left out from that
So
bracket?
yes, you're right that any kind of muscular and nervine pain we treat. With that, with top of that, we are treating all kinds of skin disorders, hormonal disorder in male and female both, and yes, infertility in male and female both. Yeah. So we are working on that to opening the channels. See, there are some channels from where we initiate the hormones. Okay, we detoxify the genital organs. Okay, so when, like, we believe, when if the physiology is correct, so you will get the perfect result. Okay, so we stimulate good detoxified blood towards the genital organs. We stimulate the hormonal uh, circulation towards the genital organs, and yes, there are people who are having a good result also. All kinds of skin disorders like allergies, yeah, urticaria, psoriasis, eczema, even we are treating the alopecia. So yes, definitely it's all about the circulation. We have to just drag the body's attention towards the regarding area to have the benefit. So we are localizing the area. So yes, there are 2 kinds of cupping also.
Yes.
Local cupping and systemic cupping, like I said. Local
Sure.
cupping means just wherever you are having the problem.
Mhm.
The system, with the system, there are channels which people don't understand. There are channels to initiate your system, whether it's a detoxification or circulation, digestion, metabolism, whether it is a urogenital system or hormonal system. There is a system which is start from your head, extend to the back, hands, and then legs. So definitely we have to open all the channels to have the therapeutic healing.
That's amazing. So interesting. What about sports related injuries? So, patients that have sciatica or sports related injuries, back pain, muscular pain.
In my career, in my practice, I saw number of athletes.
Yes.
And number of people who are going to gym doing aggressive exercise. They are coming and they are losing their blood and they are releasing their muscle tension, relaxing their body, and getting better. So yes, definitely once we remove the thick and stagnant and the collected blood, your muscle relaxes. See, and the overburden on the nerve, it goes. So definitely the muscle shrinks. You feel sigh of relief, and it improves the circulation. So you get the more relaxation in the body. Okay. So we have a number of cases with the frozen shoulder, tennis elbow. So yeah, we are treating that, and some kind of osteoarthritis also. Yeah, we have a good result with the hijama with some physiotherapy. Yes, there is a combination of therapies. So people do come. I said that people aware of the therapy, so they know the benefits, and they combine the therapy. They go for alternative ways, and they come. They are having a good results.
So, Dr. Hina, obviously, when we're doing hijama therapy and you are making superficial cuts, hygiene is something so important. Infection control is something so important. It's so important to go to a professional to get this done because the depth of the cuts, your entire protocol of infection control should be there because you want to avoid sepsis at all cost.
Yes, correct. So you're right that hygiene is a crucial part of hijama. Definitely, we had to maintain a standard
Yes.
from the beginning to the end. We had to take upgraded precautions. Okay, so that there should not be any blood infection because it's a superficial wound. Although we are removing some amount of blood, we had to take precautions for the blood infections.
So let's discuss some of the myths. Okay, because like we've mentioned before, a lot of people sitting at home don't know what hijama therapy is. And if they go and research, they see these cups that are full of blood and they may be very apprehensive. So, number one, is it painful?
Like I said, it's really not painful. For everyone, it's ticklish. Most of the time, it's ticklish only, and it's very, very superficial procedure. So I offer everybody should do hijama without any worry, without any fear. They have to just mentally they have to prepare themselves.
And I think it's because you first do the suction on its own.
Correct.
So, with that pressure of the cup, automatically that area
Gets
is
numb.
numb.
Yes, correct.
So, when you're doing the cuts, it's not to say that you're doing it on bare skin
Yeah,
initially, you're doing it after dry cupping.
correct.
First.
Yes, yes, yes.
So, number two, I think one of the concerns would be how much of blood am I going to lose?
So, like I said, it's different cups, different number of cups with different patients. So, its bleeding is also depends on your problem. Okay, if you have some muscle tension, if you have for pain, so definitely you are going to have some good amount of blood. But some patients they don't bleed. It doesn't mean that they are not going to have the result. So, this is also a myth that if you will bleed
Yes.
more, you are going to have a good result, which is a very very big myth with which I am facing with every other person. Yeah, that I didn't bleed means it's is it a
It's
good
not
session,
effective.
it's going to affect me or no. So I have to tell everyone that yes, we have to target the area correctly. This should be our motto. If you are targeting the area correctly, whether you bleed or you don't bleed, definitely you are going to have some amount of you are going to have a good result. Okay, so if there is muscle tension, like I said, their pain, definitely they are going to bleed. But if I'm covering for indigestion, for colon, for hypertension, for diabetes, so such kind of patient they don't bleed from it depends on the part of the body also. Some part of the body is not bleeding area, like I do the hijama on front also. Front is not a bleeding area, yeah, because it's active parts. It's we can it's the local cupping. We have to directly target on your directly target to your heart and lung, and you're directly have you have to target your stomach organ like liver, your stomach, colons, pancreas. Okay, so this is the active organs. It needs blood, so they are
Yes.
utilizing all the blood they have. They are working. Okay, so they need all the blood. They don't push any kind of thick blood towards the skin. And also there is too much of fascia, too much of muscle, fat, yeah,
Course.
fat layers. So to make you bleed, I need to make big suction, big cuts, right?
Yes.
So some patients they do want the good bleeding, okay,
Yes.
but I encourage them not to go with that. Okay, we have to be very gentle. Whatever amount of blood is collected under your muscle and the skin, it will come out. We need not to make deep cuts and
Of
to make you
course.
bleed with the fresh blood. We our motto is not to remove your fresh blood. So this is one of the common myths where people
Yes.
do have, that if I will bleed, then I will get the better result,
Which is not the
which
case
is
at
not
all.
true. Yeah.
And how long would you say is the recovery time? I'm sure a lot of people, when they get hijama done, they want to know, is there downtime? And am I going to be bruised? Or how long do these cuts take to heal?
Yeah, so as I said, it's a very, very superficial cut. So, like a superficial wound takes 6 to 7 days. It's a
Okay,
normal wound healing period. So,
sure.
definitely the wounds are healing within a week. You need not to worry about the scar. It never leaves you scar or any kind of mark. And the bruises, it may take 3 to 4 days. Okay, it's just a hyperemia. After three
Yes,
days, the same blood comes out in your skin, in your circulation. So definitely it's not going to be for a longer time.
of course. I mean, I had hijama done, and
Yes.
my healing process was very, very, quick and easy. I didn't even know,
Yes,
to
the
be quite
females are
honest.
worrying more about the scar. So
Yes,
they have two worries about the pain and about the scar, but they are the one who are more happy on the bed, and you are
yes,
who are very cooperative, because
of course.
it's very, very ticklish for all the females.
It's so superficial, so you're not even left with a scar.
Correct.
So, Dr. Hina, can we talk about Sunnah days? And many people around the world, maybe westernized countries, are not really going to understand what a Sunnah day is. So, can you explain more about Sunnah days? Because I always see a lot of hijama being done on Sunnah days.
Yes. So, like I mentioned you before, that it's a prophetic sunnah. So, as the Prophet advises for religious purpose, so we do hijama for a religious purpose also. It's a spiritual healing. It's for spiritual healing. When we say sunnah days and sunnah cups and sunnah hijama, it's for spiritual healing. And from the Prophet, from the Sahih Hadith, it should be done on a full moon days, yeah, which comes on each month from the Hijri calendar. It falls on 17, 19, and 21st of the month from the Hijri calendar. So the science behind that is when there is a full moon, so there is a big waves on the sea, and at the sea level, the human circulation is much faster than the other day. Okay, so people do bleed more than the other day, and it's very common when the person comes to me after doing some exercise or heavy weightlifting or even walking. Their circulation is also fast, and
Of
after
course.
massage also, sometimes I receive the
Yes.
patient after massage, their circulation is also fast, and we collect more thick and dark color blood. So yes, Sunnah days is for spiritual healing, but you can do hijama every day, anytime, for health benefits. So Sunnah days are for the spiritual healing, and for just to offer a sunnah towards the Prophet. So yes, so we have certain days fixed for that, and it's a full moon date.
So, if we have to look at detoxification, I know lots of patients come in and they want to detox and they come for hijama therapy for detoxification. But in medicine, of course, we learn that the body detoxifies itself. Okay. So, as this form of alternative therapy, hijama therapy, how does that assist with detoxification? Can you explain maybe a little bit of physiology behind that?
Yes. So, like we know that body detoxifies itself.
Yeah.
When we say this, what does it mean? There is a millions of chemical reactions going inside our body, and at the end product of all chemical reaction always not be a good product. There
Of
is some
course.
wastage, some thick blood, some bad protein, some kind of acids. Okay.
Yes.
So yes, body detoxifies. Everyone know, but where these products are going? So body knows that I don't need this hard particle, this thick particle, the dead cells inside the circulation, so it pushes it towards the most peripheral part of the body, and that is the skin. So it all collects under your skin, layer to layer, and through the through the incisions we remove that blood out. So
I
body
see.
detoxify, the internal circulation is clean, but where these particles are going, it's still in your body, you need to let it go out. That's why we offer hijama like a precautionary measures also, prophylactic purpose also, you can do hijama.
Sure.
Like if you don't have anything, if your concern is you don't have any pain, you are not sick, and you don't have any ailment, then also you come and just detoxify, just help your body to get the good circulation.
Of course. Wow. So, for all our viewers at home that's watching this, what advice do you have for them?
Like I said, you can do hijama for precautionary measures also, and if something happened for that also, you can try hijama, definitely. So to my every patient I offer hijama like a lifestyle. If you like, you are going to a movie, you are
Yes.
going for a dinner night, you just come and pamper yourself, let your body help your body to relax and rejuvenate yourself. So definitely we are offering hijama to everyone, anytime and any day.
Thank you so much, Dr. Hina. This was so insightful, and I hope that all this information that you have given us today really impacts on someone's life. And now that more people are aware that hijama therapy is available as a form of alternative therapy, I really hope it can make a difference in their journey. Like you said, as a precautionary preventative health measure or as a therapeutic one. So, thank you so much for gracing us with your presence and all your valuable knowledge that you have given us today. Thank you.
Thank you so much for having me here.
Hijama therapy can be a very useful tool in your health and wellness journey. So, should you require any more information or have any questions, please feel free to contact us at Orthosports. And don't forget to hit the like button and to subscribe to our YouTube channel for more information and amazing videos about health, wellness, and fitness. Thank you so much. Till the next time, take care and stay healthy.